In this video, we will talk about the new epidemic of 2024. It is the outbreak of monkeypox. What is a monkeypox virus? Monkeypox is a zoonotic viral disease caused by the monkeypox virus, a member of the orthopox virus genus, which also includes the variola virus, the virus that caused smallpox. History of monkeypox. It was first discovered in 1958. In monkeys kept for research. The first human case was recorded in the Democratic Republic of Congo in 1970. What is the structure of monkeypox? It is a large, brick-shaped virus, with a double-stranded DNA genome. Types of monkeypox viruses. There are two types of monkeypox viruses. West African clade. It is typically associated with milder disease, and lower mortality rates. Congo Basin, Central African clade. It is associated with more severe disease, and higher mortality rates. Geographical distribution. Following are the endemic regions of monkeypox. Central and West African countries, such as the Democratic Republic of Congo, Nigeria, Cameroon, and the Central African Republic. Global spread of monkeypox. Cases have been reported outside Africa, including in the United States, the United Kingdom, and Israel. These cases are often linked to international travel or imported animals. Recent outbreaks of monkeypox. It occurred in 2022, the global outbreak that saw cases in multiple non-endemic countries, raising international awareness. Transmission of monkeypox. It is transmitted by two ways: animal to human transmission, human to human transmission. First we will discuss animal to human transmission. Primary transmission is by contact with the blood, bodily fluids, or cutaneous or mucosal lesions of infected animals, primarily rodents and primates. Possible sources. It is transmitted by handling of bush meat, bites, or scratches from animals, or using products made from infected animals. Now we will discuss human to human transmission. It is transmitted by three ways: direct contact, with infectious skin lesions, or bodily fluids, respiratory droplets. Prolonged face-to-face contact can result in transmission, through respiratory secretions, vomits. Contaminated objects such as bedding or clothing can facilitate transmission. Incubation period of monkeypox infection. It is typically between 5 to 21 days. What is the clinical presentation of monkeypox infection? Symptoms. Initial phase. It is between 1 to 5 days. Patient presents with fever, intense headache, lymphadenopathy, back pain, muscle aches, and fatigue. Next phase is rash development. It begins 1 to 3 days after fever onset, starting on the face, and spreading to other parts of the body, including palms and soles. Last phase is the stage of lesions. It progresses from macules to papules to vesicles to pustules to scabs. How to diagnose monkeypox infection? There are two phases of diagnosis. Number 1, clinical diagnosis of monkeypox. It is based on the characteristic rash, history of potential exposure, and presence of symptoms, like fever and lymphadenopathy. Number 2, laboratory testing methods. PCR test. It is the gold standard for detecting monkeypox DNA in samples from skin lesions. Virus isolation. It is done in specialized laboratories for further confirmation. Serology. It is done by detecting antibodies against the virus in patients. Treatment of monkeypox. Step 1. Supportive care. Symptomatic treatment includes pain relievers, hydration, and treatment of secondary bacterial infections if they occur. Step 2. Antiviral treatment. Tecovirimat. It is approved for treating smallpox, and considered for monkeypox under investigational protocols. Cytofever. It is another antiviral, though less commonly used due to potential toxicity. Vaccination against monkeypox. Smallpox vaccine. It provides cross-protection against monkeypox. Vaccination post-exposure can reduce the severity of the disease. Newer vaccines. Jynneos is a newer vaccine specifically approved for monkeypox prevention in certain countries. Prevention of monkeypox. Following steps can prevent the spread of monkeypox. Number 1. Animal-related precautions. Avoid contact with wild animals, especially those that appear sick, or are found dead. Practice good hygiene after handling animals, or animal products. Number 2. Human-related precautions. Isolate infected individuals to prevent spread. Use of personal protective equipment by healthcare workers and caregivers. Educate communities, especially in endemic regions, about the risks and prevention methods.